if you're already not feeling comfortable with that doctor and you feel like they're kind of just standoffish or just kind of blow you off, you really probably don't want them to put your IUD in. Because 9 times out of 10, they're going to be putting it in and and
Yeah.
not really caring about your pain level. You know what I'm saying?
Right. Is there anything that doctors like can prescribe? Like, is there local anesthesia or anything like that when that happens? What can a patient or a parent, advocating for their child,
Right.
ask for?
Right, right. So I would say that all of us are different, right?
Right.
So for the most part, I think there's some who don't, recommend any pain medicine. I personally, a lot of the doctors in my practice, we usually would tell patients to pre-medicate with some ibuprofen, an hour or so before the actual procedure. There are some doctors who actually did give local at the time of the IUD placement, some injections of lidocaine right around the cervix, before. So it really kind of depends on the doctor. And it also depends on the person, right? There's some people can have higher pain tolerance and, so I also as a doctor kind of judge people based off their actual pelvic exams.
Right.
Because I definitely want to do that first before I even talk about placing the IUD. Because if you can't tolerate a speculum exam,
Right.
that's a problem, right?
Yeah. And I mean, I
Yeah.
think it's like with this mom whose daughter hadn't had sex yet. Right.
Right.
Speculum is not good. I mean, speculum is not pleasant anyway.
No,
but it's
right,
definitely
exactly.
not going to be pleasant in that situation.